Thank you, Rob, for the introduction, and thank you to you all for joining us today for our Employee Benefits webinar, where we'd like to share with you our thoughts on how you can help and support your employees as well as yourselves during this challenging time. As we begin to think about what the new normal will look like for employers as lockdown is now gradually starting to ease, inevitably it is a difficult and uncertain time for both employers and their employees. There are many employees feeling that they could be losing their job, and some have already seen their salary reduced to 80% of their basic pay. Early statistics show that the government are expecting 9 million employees out of the 26 million UK workforce to be furloughed. Therefore, it's unsurprising that employees are facing financial uncertainty in the coming months. There's the compounding effect for employees who have not yet passed their probation, culminating in delayed appraisals, and all these concerns are superseded by potential illness and even death of a loved one. So the COVID-19 crisis and the ongoing lockdown has left employees and employers feeling anxious and worried about their future, prompting many employers to look for ways to continue to support their staff now and in the months ahead. As an employer, there are steps you can take to support your employees. One benefit that I believe has been undervalued, underused, and also potentially undercommunicated to the employees is the Employee Assistance Programme, or Employee Workplace Wellbeing Service. Now, like many businesses, you are probably experiencing significant challenges because of the pandemic. And during times like these, feelings of distress and anxiety become more apparent than ever. Typically, 1 in 4 people in the UK suffer from mental health problems during their life, and recent increases in financial insecurity, social isolation, and loneliness as a result of COVID-19 has unfortunately seen this number rise. You may already have an employee assistance programme, including as a value-added benefit alongside one of your other employee benefits, for example, a group income protection scheme. You may not know that you have this available either. If you are fortunate enough to have this service, we would absolutely encourage that this benefit is communicated to all employees to offer additional support at a time when they may need it most. The benefits are usually included are a confidential, unlimited, 24-hour, 7-day-a-week counselling helpline, an employee wellbeing portal, support for managers, online mental health awareness training, online stress management training, and face-to-face counselling. However, this is usually subject to a counsellor referral. Over recent weeks, providers have found that calls have increased by 48% of these helplines recently. So if you do have one, please communicate it to the employees, as it may help them through the challenges they may be facing on a personal or work-related issue. Stress, relationship breakdown, financial concerns, and health issues, and also bereavement, to managing workloads and also managing the home-work balance, which has become difficult for many people. Another value-added benefit, auxiliary benefit, that's become very, very popular is the 24-hour GP online access. Now, this benefit gives the employees 24 hours a day, 7-day-a-week access to GP appointments. With a simple tap of their phone, many can also feature a COVID care assistant to help recognise COVID symptoms. This particular benefit can be made available as a standalone benefit, or like the Employee Assistance Programme, can also form part, as I mentioned earlier on, of a value-added benefit. With many group private medical insurances, for example, Bupa have Digital GP, which is provided by Babylon. AXA PPP have the Doctor at Hand service. Aviva has the Aviva Digital GP. And Vitality have Vitality GP, which is included in their core cover. Or, again, it can be available standalone. It's usually a challenge in itself to make an appointment with one's GP at the best of times, let alone trying to speak to one during lockdown. And with the ongoing challenges we are sure to face with the easing of it, this benefit is surely one that will inevitably prove to be popular with both employers and employees. Providers have seen an increase of 45% usage in these services in the last couple of months. And maybe not surprisingly so, but 41% of employees aged 18 to 24% have turned around and said that they would actually rather use this service rather than going to see the GP. So GP online service providers work across all industries to help reduce absenteeism, increase productivity, and bring staff peace of mind. Many of them now also have COVID-19 support that helps your employee identify if they're at risk and can connect with them with an expert clinician, all without leaving their home. Symptom checker tool, this is available with a lot of companies whereby the employees can check the symptoms instantly and get the most appropriate health information. But I think more importantly, the video appointments whereby they can talk to a GP at any time of the day or night and get an appointment usually within a couple of hours. These online GPs are also able to give private prescriptions that can be sent straight to the nearest pharmacy or delivered to the doorstep. However, please note there's usually an additional charge for these private prescriptions. So providing a good selection of benefits that are attractive and relevant to your employees should be a fundamental consideration for your business. The solution does not have to be expensive, and the return could be well in excess of your initial investment. So many of the popular benefit choices are like going into supermarkets whereby you buy one product and you get at least one other free. So you get a free auxiliary benefit. There are certain product providers that offer superb auxiliary benefits in addition to the product itself. For example, you could purchase an income protection scheme for your employees and then receive an employee assistance program and an employee discount scheme free on top of that. And these benefits are actually available to the uninsured population in addition to the insured population. So we strongly recommend that you find out what additional complementary benefits are available through your benefit provider or employee benefit provider. There have been many additional new benefits and features that have become available through numerous group providers recently following the pandemic. For example, to give you an example of one, Canada Life, if you're actually on the class online portal for the group risk projects, and that could be group life, group income protection, they're now providing a brand new support service available to all employees called We Care. Now, We Care, again, is a 24-hour, 7-day-a-week online GP. It provides mental health support service. It's got Get Fit exercise and diet programs and many, many more features, all at no additional cost to the employer or to the employees. It's also available for the employee's immediate family in addition. The mental health support will prevent burnout the mental health support prevents burnout, tackle major life events, or learn to deal with stress and anxiety, and employees get up to 10 sessions with a mental health professional. The Get Fit program has qualified nutritionists that will support the employees with bespoke fitness programs ranging from diet and exercise plans to helping them stop smoking. Aviva also has a similar project, and that's called Thrive. Now, it's great having all these benefits, but what about how you're going to communicate the benefits to the employees? Well, again, it may be a challenging time with everything because you're not physically maybe seeing the employees on a daily basis. We've found Zoom calls to prove popular, inviting individuals to webinars, which a lot of the providers provide free of charge, sending your employees emails with useful information, internal intranet, whereby you can provide regular updates. For example, we use Yammer, that we go and check updates on a daily basis. If you're in work, you could use the posters, and also social media network, updating any information you have there. And also, you have the personal calls, whereby you pick the phone up, have a chat to them, and let them know what's available. I would now like to move on to the group risk questions that we've had in through our clients that may help you. First question is, are eligible employees covered if they die from coronavirus? The answer to that is yes, group life policies do cover death by any clause, including coronavirus. Question 2, where an employee has been furloughed had their hours or pay temporarily reduced by their employer, will the cover be based on members' salary prior to the reduction? So the answer to that is for group life, in the event that an employee is subject to reduced pay, moved to 0 hours, or has been furloughed, group life providers would continue to offer cover based on their full pay, provided that a contract of employment remains in place and premiums continue to be paid based on the full amount of cover. Question 3. Will group income protection benefits be reduced for employees who have been furloughed or who have temporarily had their salaries or hours reduced? The answer to that again is as long as premiums and data continue to reflect the full contracted salaries, providers would maintain cover accordingly, and the standard terms and conditions would continue to apply. Next question. Are members absent from work due to being furloughed classed as actively at work? Members who are absent from work due to being furloughed but who are otherwise have not received medical advice to refrain from work and are mentally and physically capable of performing fully their normal regular duties associated with their job that they're engaged to do will be classed as actively at work. Will the providers maintain cover for employees who are volunteering? Yes, they will, as long as the contract of employment is maintained and premiums continue to be paid. Cover would continue in line with the standard temporary absence provisions. Would a claim be paid for coronavirus under a critical illness policy? Interesting question. Although coronavirus isn't a covered condition on critical illness policies, if complications as a result of the virus lead to other criteria being met, for example, kidney failure, liver failure, heart failure, or respiratory failure, the claim would be met subject to the terms and conditions of the policies. Are the providers able to help employers struggling financially to pay their premiums due to coronavirus? Well, most providers are keen to help their customers maintain their cover and would consider flexibility for those who needed it. Moving on to the healthcare frequently asked questions. Are private facilities available to use now? Private hospitals and medical professionals were redeployed during the coronavirus emergency to support their NHS colleagues. This meant most diagnostic services and non-urgent operations were temporarily unavailable. Fortunately, the NHS is reporting that they have enough beds, intensive care unit equipment, supplies and staff. This means that some private healthcare facilities are no longer needed to support the NHS. Are all private facilities available now? No, unfortunately. The private health sector are beginning to accept some private patients again, and this is likely to happen in the next few weeks. Not only will availability vary by on location, but also by specialism and any further support the NHS may need. So not all facilities will be available. And if the NHS need further support in the future, those that are available may potentially become unavailable again. Can you go privately with your policy and request testing for COVID-19? No, unfortunately, your private medical insurance cannot provide cover just for private diagnostic testing for COVID-19. This testing is available through the current route only, so visit the Welsh Government website for further details. Does the healthcare scheme cover the treatment of coronavirus now? No. There are still no private facilities within the United Kingdom offering services to patients who have been diagnosed with or who are suspected of having COVID-19. All cases are currently managed by the NHS and Public Health England and Wales, who also manage all resources. The reason for this is so that the government can continuously monitor, assess and manage the situation. As a public health emergency, COVID-19 is being treated through the public health system. So therefore, if you need to receive NHS treatment for COVID-19, you would be able to claim a cash benefit per night stay up to a certain limit where this is included in your policy. There are also additional support available, so most healthcare providers offer a wide range of healthcare services and resources in addition to the ones I've discussed which can be accessed from the safety and comfort again of your own home. So these include the telephone helplines I was discussing, but also specialist help with physiotherapy, right through to chemotherapy at home for cancer patients. That concludes my section of the webinar, so don't forget, if you have any questions on anything I've covered, or if we can be of further assistance at all, please don't hesitate to contact us. Details will be available at the end of the webinar. I would now like to hand you over to my colleague Tom, who is going to discuss your employer duties with workplace pensions and the changes that are being introduced over the next couple of months by the government with regards to the coronavirus job retention team. Over to you, Tom.
Thank you, Nia. Since 2018, all employers have been required by law to set up and enrol all eligible employees into a qualifying workplace pension scheme. This is overseen by the pensions regulator, which I will refer to as TPR. This is the public body that protects workplace pensions in the UK. COVID-19 has had a significant impact on employers, and as of 31st of May, 8.7 million employees out of the 26 million UK workforce have been furloughed using the coronavirus job retention scheme, which I'll refer to as CJRS. Firstly, I will address your duties as an employer set out by TPR, then discuss your options around pension contributions and the integration of CJRS, followed by an explanation on how salary exchange, also known as salary sacrifice, is effected, then conclude with a focus on how you can support your employees through this period of uncertainty. Please note, all information from this workplace pension scheme section will be available on our COVID-19 risk management updates and advice hub page at the bottom of this slide. In a recent publication, TPR stated, "We know that this is a challenging time for everyone, and we recognise the strain this is putting on employers. We will take a proportionate and risk-based approach towards enforcement decisions in light of these challenging times, with the aim of helping to get employers back on track and supporting both employers and savers." TPR's guidance is clear that you need to keep contributing to pension schemes in line with your current commitments, and that employer and employee contributions should still be paid to the pension scheme within the usual timescales. Your workplace pension scheme duties remain unchanged. Therefore, please continue to follow your normal processes, such as enrolling eligible job holders and completing the re-enrollment process. An employee may take the personal decision to opt out and cease active membership of the pension scheme. Subsequently, both employer and employee contributions will cease for that individual. In the event that an employee is off work due to illness, you will need to continue deducting contributions from their salary. Statutory sick pay is part of the qualifying earning rules for automatic enrolment. The rules and guidance on payment of contributions have not changed. However, if the breach is inadvertent because of the current pandemic, then it is probable that TPR will take a more sympathetic position, as long as appropriate measures are taken to rectify the situation. If the breach is for an extended period and unlikely to be easily corrected, we would encourage you to report this to TPR. The CJRS is a temporary scheme designed to support employers whose operations have been severely affected by coronavirus. Under the CJRS, HMRC will reimburse 80% of a furloughed employee's salary costs, up to a cap of £2,500 per month, plus the associated employer's national insurance contributions and minimum automatic enrolment employer pension contributions on that salary. The CJRS will be closed to new entrants from 30th of June. So to qualify, 3 weeks furlough must have been completed by 30th of June, and relevant employees must have been furloughed by 10th of June. From 1st July, furloughed employees can be brought back for any amount of time or any shift pattern. For the hours that the employee is working, the employer must pay their normal wages. For the time that they are not working, you can still claim 80% of wages capped at £2,500 per month, and the associated employer national insurance contributions and minimum employer pension contributions. From the 1st of August, funding from the government will stop for the associated employer national insurance contributions and employer pension contributions. Therefore, employers will be required to fund these. In September, the grant reduces to 70% of wages, capped at £2,187.50 for periods where the employer is not working, and employers fund the additional 10%. In October, the grant reduces to 60% of wages, capped at £1,875 per month for the periods where the employee is not working. Employers fund the additional 20%, and the scheme is scheduled to end on the 31st of October. Employers may only claim for pension contributions based on statutory auto-enrolment minimum, i.e. 3% of qualifying earnings between £6,240 and £50,000. Contributions in excess of the auto-enrolment minimum will not be funded by the CJRS grant, but must continue to be paid by employers in accordance with the scheme rules and contracts of employment. If the scheme's contribution basis meets the statutory minimums, then the certification basis can be changed. If you're contributing above the minimum of 3% of pensionable pay, it is possible to reduce your contribution. However, if you employ more than 50 employees, you would normally be expected to carry out a 60-day consultation with employees. TPR has said that they are waiving enforcement of this rule, but still recommend employers communicate any changes to employees. We strongly advise that you review your current contractual arrangements and seek legal advice before making any changes. Some employers will be using salary exchange to make pension contributions. It is an arrangement where an employee agrees to give up some salary or bonus. The amount given up is used by the employer to provide a non-cash benefit to the employee, in this case, a pension contribution. As the employee is being paid less gross salary, the employer makes national insurance contribution savings, and the employee pays less tax and national insurance. The CJRS grant is based on the employee's salary after salary exchange as of 19th of March. Subsequently, this will reduce the amount of grant the employer will receive from the scheme for an employee in comparison to those not on the salary exchange arrangement. It also means the employer will only get 3% of qualifying earnings to cover the employer's minimum auto-enrolment contribution based on the reduced salary. It is important to note that all the grant received to cover an employee's subsidised furlough pay must be paid to them in the form of money. The grant cannot be reduced to pay for the pension contribution. Therefore, the responsibility lies with the employer to fund the employee's contribution as well as the additional employer contribution if above 3% of qualifying earnings. HMRC has confirmed that COVID-19 counts as a life event that could warrant changes to salary exchange arrangements if the relevant employment contracts are updated accordingly. However, changing the arrangement now will not alter the grant because the salary used for calculating the grant is as of 19th March, and if they do this, it will have an impact on both employer and employee national insurance contributions. In summary, if an employer is using the CJRS and implementing a salary exchange arrangement, they are exposed to the shortfall. However, it is important to remember that in times of normality, the arrangement offers potential tax advantages both to the employer and employee. If this is something you're interested in, please do not hesitate to contact us at Thomas Carroll Employee Benefits. Communication is paramount, particularly when employees' pay or benefits, including pension contributions, are being altered. In this instance, formal communication, usually by letter or email, is strongly encouraged. On an ongoing basis, a major concern is the increased risk of criminals using this period of uncertainty to try and defraud employees of their retirement savings. The most likely route during the current crisis is offering to transfer pension monies to apparent safe havens to avoid market volatility. Scams in the pensions world have been on the increase since the introduction of the pension freedoms last decade, so employers and employees need to be aware of this risk. Please refer to the Financial Conduct Authority's Scam Smart site to check the validity of any pension sales claim. We would encourage employers to share these details with all their employees. The recent volatility of the financial markets will have worried many pension savers, and it is difficult to say what impact it will have on any one saver. This is because there are several factors which influence their ultimate fund value and pension outcome, such as age, contribution level, investment choice, and their personal retirement goals. So for some savers, the recent volatility in the investment returns will only have a negligible impact, whilst others it might be more significant. Therefore, it is difficult to generalize as to how recent events may have impacted their retirement planning. It is, however, likely that all savers will welcome supporting information to better understand the potential impact of the current volatility on their pension savings. Advice on pension investment should only be offered by an appropriately qualified and regulated individual. Therefore, employers should avoid offering any advice. We believe very strongly in employee education for the benefit of both the employer and employee. In providing presentations, one-to-one meetings, and more recently webinars, employees develop an enhanced understanding of their employee benefits, such as their workplace pension, and in turn a realization and appreciation of what their employer is providing. If you would like more information on employee education, please do not hesitate to contact us.